Blood conservation is most critical in which group during CPB? A. Patients undergoing lung transplant. B. Pediatric cardiac surgery patients. C. Adult CAB patients. D. Patients with chronic hypertension. Answer: B. Pediatric cardiac surgery patients. Explanation: in children, the blood volume is small compared to the priming volume of the CPB circuit. Any hemodilution can have a profound impact, so aggressive blood conservation strategies are crucial. Which method improves platelet function preservation during CPB? A. Hypothermia during bypass. B. Leukodepletion filters. C. Use of biocompatible, heparin-coated circuits. D. Increasing heparin dose. Answer: C. Use of biocompatible, heparin-coated circuits. Explanation: heparin-coated circuits reduce platelet activation and destruction by minimizing contact activation, leading to better preservation of platelet function and reduced bleeding risk. In the setting of significant blood loss during surgery, salvaged blood using a cell saver should not be used if A. Blood loss is greater than 500 milliliters. B. The surgical field is infected. C. The patient is hemodynamically unstable. D. There is active bleeding. Answer: B. The surgical field is infected. Explanation: in cases of infection or malignancy, salvaged blood should not be rain-fused because it could introduce pathogens or tumor cells into the systemic circulation. Acute normal volemic hemodilution, ANH, is contraindicated in patients with A. High preoperative hemoglobin. B. Moderate anemia, HB less than 10 g/dl. C. Good cardiac function. D. Young, healthy patients. Answer: B. Moderate anemia, HB less than 10 g/dl. Explanation: patients with significant preoperative anemia are poor candidates for ANH because further blood removal could dangerously reduce oxygen delivery during surgery. Which of the following is the greatest advantage of using antifibrinolytics during CPB? A. Decrease in systemic vascular resistance. B. Reduced transfusion requirements by decreasing bleeding. C. Increased oxygen delivery. D. Shorter CPB time. Answer: B. Reduced transfusion requirements by decreasing bleeding. Explanation: antifibrinolytics like tranexamic acid or aminocaproic acid inhibit clot breakdown, reducing surgical bleeding and therefore decreasing the need for transfusions. In blood conservation strategies during CPB, autotransfusion mainly refers to A. Infusion of donor plasma. B. Rainfusion of patient's own blood collected intraoperatively. C. Preoperative blood donation. D. Injection of erythropoietin. Answer: B. Rainfusion of patient's own blood collected intraoperatively. Explanation: autotransfusion refers to collecting the patient's blood lost during surgery, using cell savers, and then rainfusing it back into the patient, reducing the need for allogeneic, donor, blood transfusions. Which factor increases the risk of needing transfusions during CPB? A. High body surface area, BSA. B. Low preoperative hematocrit. C. Retrograde autologous priming, RAP. D. Use of antifibrinolytics. Answer: B. Low preoperative hematocrit. Explanation: a low starting hematocrit before surgery makes the patient more vulnerable to hemodilution during CPB and increases the likelihood of needing transfusions. Pre-bypass blood conservation in CPB includes all except A. Acute normal volemic hemodilution. B. Retrograde autologous priming. C. Crystalloid overloading. D. Minimizing circuit prime volume. Answer: C. Crystalloid overloading. Explanation: crystalloid overloading leads to hemodilution, lowering hematocrit and worsening coagulopathy. The goal is actually to reduce unnecessary fluid loading pre-bypass. Which blood conservation strategy directly removes inflammatory mediators during CPB? A. Leukocyte filtration. B. Retrograde autologous priming. C. Modified ultrafiltration, MUF. D. Microplegia. Answer: C. Modified ultrafiltration, MUF. Explanation: MUF performed after CPB not only concentrates red blood cells but also removes low molecular weight inflammatory mediators like cytokines, improving postoperative recovery. Hemodilution during CPB is mainly caused by A. Blood loss. B. Use of heparin. C. Priming of the CPB circuit with large volumes of fluid. D. Administration of protamine. Answer: C. Priming of the CPB circuit with large volumes of fluid. Explanation: the priming fluid used to fill the CPB circuit, often 1 to 2 liters, mixes with the patient's blood, diluting it and decreasing hematocrit, and less conservation techniques like wrap are used.